Hello, my name is Nathan Tu, and I'm here to talk to you about a drug called Imetelstat, or by its proper name, GRN163L. It is a telomerase inhibitor that seeks to act as a cancer therapy in rapidly dividing cancer cells by inhibiting telomerase action and preventing replicative immortality. As you can see here, H-TERT, or telomerase, as we know it, is comprised of multiple different protein subunits, but most importantly, it has an RNA subunit, as you can see, tracing through the middle there, and this is what gives the telomerase its specificity, as well as acting as a target for our drug imetelstat. Our drug imetelstat, as you can see in the next slide, will bind to the red lettering template of the telomerase RNA and works by mimicking the telomeric DNA, outcompeting it for telomerase binding activity. Therefore, telomerase, or TERT, will not be able to bind and affect its actions, elongating the telomeres. As you can see, telomerase, or H-TERT, is typically recruited to the ends of telomeres using a protein complex called shelterin, in particular a protein complex called TPP1, which has notably had several mutations affect its recruitment. However, this one directly affects telomerase itself. As you can see here, replicative immortality is a key hallmark of dividing cancer cells. As they grow through different numbers of cell divisions, they eventually reach a limit and they must proceed with replicative immortality if they wish to continue dividing. This is done by switching on the expression of telomerase and continuing with replicative immortality, allowing them to stay genomically stable. As you can see here, this is a graph indicating that although telomerase is normally switched off in most human cells, there exist strong mutations that favor re-expression of telomerase in these cancer cells, allowing for this replicative immortality to occur. This is really crucial because, as you can see here, chemotherapy, when combined with telomerase inhibitors, results in a durable response due to the fact that you're attritioning both the ends of the telomeres and the cancer itself under metabolic stress using traditional chemotherapy. Now you may be asking yourself, what might happen if, say, for example, our stem cells were to be affected by this telomere inhibition? Now, as you can see here, our stem cells exist at a much higher level of telomeric repeats than these cancer cells, which often sit at a very short level, a critical level, if you will, just above genomic instability. By inhibiting telomeres for just a small portion of time, as you'll see right here, you should be able to remove cancer cells' ability to replicate and will actually cause them to fall out of the population entirely, whilst harming none of your original cells of the body. This is really key, especially if we want to create a helpful therapy for cancer patients that won't affect all of us long term. As you can see here, H-TERT, or the protein component of telomerase, has a number of different therapies designed to inhibit it or affect its binding partners or such, but imetelstat is unique in that it binds directly to the RNA component of H-TERT while it is around in the cell and preventing it from binding to these ends of the telomeres. As you can see here, it directly mimics the 3' overhang that H-TERT would typically look to and bind to, and with the presence of its palmitoyl tail, as we'll see in the next slide, it has a great affinity for cell cytoplasm and does not easily get stuck in solution. As you can see here, imetelstat actively binds H-TERT, inhibiting it, preventing it from binding, and its palmitate tail actually helps with cell diffusion, both allowing it to stay prevalent in tissue and not get readily exported by the cancer cells. It's a good therapy, and as we'll see in the next couple slides, this is by Gurn, the actual company that promotes and markets this drug, along with conducting clinical trials. The long tissue residence time and the very good IC50 for this drug indicates that it's a strong candidate for cancer inhibition, as well as acting as an excellent drug target for further iterations. This is a log curve of the GRN dose versus telomerase activity as a percentage. And as you can see here, this is very good data, scaling with decreased activity with increased dosage. We'll see a quantification of that for different cell lines in the next slide. And as you can see here, with different cell lines, you increase the dosage of GRN163L, and you have error bars indicating just how likely it is that telomerase expression is proceeding in these. So we do see that it is a fairly potent anti-cancer therapy and does show good pharmacokinetic and dynamic data, as we'll show shortly. This is, as you can see, an area under the curve. So this is in fact your kinetic data showing that this drug does work very well in the body. It freely diffuses throughout tissue. And this is a pharmacodynamic slide showing just how well it is at affecting telomerase activity, even with a single dose. So it's readily bioavailable and it readily affects telomerase, affecting cancer cell growth as well. As you can see here, this is a bit of safety information detailing with two different dose measures, the number of adverse events, the most common one being thrombocytopenia. However, this is actually somewhat of a good thing because it indicates that the cancer cells are being killed very readily and are actually clogging up the spleen and pancreas, and this can be easily and preventively reduced. Talking about Lipinski's rule of 5, these are some measures of this drug candidate. As you can see here, it's fairly unstandard as far as drugs go, and this is represented in the Lipinski's rule of 5, of which it does not follow any characteristic except for the log P. In the future, Geron, this company, is actually presenting further data about their clinical trials in stage 2 and 3 in a meeting upcoming on December 5th through 8th. If you're interested, feel free to attend. Otherwise, my name is Nathan Tu. Again, my drug was Imetelstat, and thank you for listening.